Push the button, Frank. You never heard that?
No, I haven't.
Oh
God. I'm not sure what's happening.
No one knows what's happening on your head. It's fine.
Oh, no one knows what's happening on your face.
Well, we're just a mess. We're just a pair of special people.
Yes,
oh, man. We missed again last week.
We did.
It was busy.
You were a little cranky last week.
It's because it was busy.
It was busy.
It was craziness. But we're back. Yay!
We're back.
That's creepy.
That's so creepy.
Oh, man. So we decided today to talk about emergencies.
Emergency!
You know why?
Why, what?
Do you know why I picked the song?
Well, yeah. I already previewed what you guys are about to see, so.
Well, I gotta play the song. Guess what it is? Some Foreigner.
Yeah.
I don't know why, but I feel like it should be one of these.
Don't let it go too long. Lord.
I do love some Foreigner in my life. And Daddy taught me that.
Yeah.
Yeah, he likes Foreigner too. We've been to a couple of concerts, I think.
Rich Hogan Kelly's
Rich
dad.
Hogan Kelly's dad likes Foreigner and Styx and all them sorts of peoples. So yeah, so we're talking about emergencies. So, what is our general rule of thumb? Like, what things are emergencies?
So if your pet is having trouble breathing or
That's a big
seems
one.
distressed when it comes to breathing, so whether they're gasping for air, they're breathing very quickly, rapidly,
And not just panting.
right.
Like, obviously panting is normal, unless you have a cat
Yeah.
who is not otherwise stressed. So cats, when they come into the hospital, sometimes they will pant or open mouth breathe because they're stressed. But if your cat is just like lounging around at home and going, that ain't right. That ain't right. Cats don't open mouth breathe. Not for any good reason. So, that's considered an emergency. For sure. Yeah, what else?
We had someone call last night who they said their dog just collapsed.
That might be urgent.
What do you mean might be urgent? It's urgent. They need to be seen somewhere.
Sometimes I just collapse for no reason. No,
That's just because you're old.
It's just called falling over. So yeah, collapse. Yep, that's a good one.
Let's see. If you have, especially a male cat, but if you have a cat or a dog in general that is not able to produce urine, so they're trying, they seem distressed, they can't go, that's an emergency. If you have a cat that is trying to pee and little bits are coming out, okay, it still needs to be seen, but if you have a cat that is not peeing at all, that is a medical emergency and they need to be seen ASAP.
Why?
Because they can have a urinary blockage, and so basically their bladder is filling up and filling up and filling up. They're not able to get any of that urine out, so their bladder can actually rupture. And that's really, really bad. Really bad.
Shockingly.
Shockingly.
That's a bad thing.
Yeah.
So yeah, because the kidneys don't stop producing urine. They just keep filling that bladder up until it can't be filled anymore. And then it
like
just
a little water balloon.
pops like a little balloon.
And
now we have what's called the abdomen. Yes, ma'am.
I have seen one, and I know a lot of people are going out of town lately. I have seen one cat that actually came in DOA, so it was dead when it got there. We did a necropsy on it. The guy was like, I went out of town for a weekend. The cat was home by himself, but he had food and water and all of that. his cat got so stressed that
Mm-hmm.
he wasn't going to the bathroom, and that's actually the only thing we could find
Mm-hmm.
that was wrong with him, and his bladder was really, really, really bad.
Yeah.
So if you're going out of town, I would always make sure that you have someone at least once a day or every other day going to check on your cat.
Yeah.
Because they may seem like they don't need a whole lot, but they can get stressed just like dogs.
They sure can. Yeah. And cats are strange little creatures. They
are.
you know, when they get stressed, there's all kinds of things that can happen. Upper respiratory infections is one. But also, yeah, they can get what's called feline lower urinary tract disease, which I think we've talked about, which basically has all of the physical, like, feelings and, like, the bladder's swollen and there's blood in the urine. It's like they have a UTI, but it's in relation to stress versus the bacteria. But they can get blocked from that, so, yeah. Have somebody checking on them at least, I would say at least once a day.
Yeah.
At least. Plus, you never know what could happen. Like, what happens if they dump their water bowl or something? Now that's gone, and how long are you going to be gone for? So, you know,
Or
checking
if they
at
get
those
stuck
things.
somewhere,
Right.
or you just
Yeah.
never know.
Yeah, I had a cat once that we weren't out of town, we were home, but we were doing some construction in my house, as is common, and one of the floor vent covers was off. He sure as heck did make his way in there. I was like, you little stinker. I may have used other words, but I'm trying to lure him back out of the ductwork that's in the basement. That was awesome.
God.
So yeah, if we hadn't been home, who knows? Who knows? I assume he would have made it out eventually because he really liked food, but you never know.
Yeah. Well, when Dino was a kitten, he got his collar stuck in his mouth, and so he's like that, and he got sores on the sides of his mouth. I mean, I don't know how long he was like that. We weren't gone,
Right.
but I was at work, and I came home, and his collar was stuck in his mouth, and so things. He is a doofus, and now he won't wear collars, so who knows?
That's okay. He's traumatized.
He is. Like when my parents left me at Universal Studios.
That's exactly what I was thinking. Oh my god.
You
what
don't
else?
know that story, you just ask.
What else?
I'll be happy to tell you.
Is an emergency?
Let's see. If your pet's gums look really pale, or if your pet is yellow, not like their hair, but their gums, like the insides of their ears, eyelids,
Whites
things
of their
like that.
eyes.
Yeah.
Yeah, those are looking yellowy. Yes, if they're very pale, so gums and insides of eyelids should look bubblegum pink. If they are not, that's a problem. Or if it looks like purpley blue, that's not good. And that usually kind of goes along with some respiratory signs, typically, but not always. What else? What else do you have? Bleeding.
Bleeding. Well, I
always say
I kind of
blue,
assumed that would be
blue, blocked, bleeding, or bloated is what I kind of categorize things into. Because usually, like, things like collapse, there's usually some other symptom, something that's happening along with that. That's one of those four. So blue, again, referring to like gum color, or if they're pale, because they're not getting good oxygenation. So either because they have a respiratory problem or heart disease, or potentially they're bleeding internally. That could be another reason that that's happening. Outward bleeding. So I'm not talking about like a torn toenail. Like, put some pressure on that for about 5 minutes. It will be fine. I promise you. But that's not really, I mean, that's like, it needs to get addressed, but it's not like, they're not going to bleed out and die, I promise you. Unless they have some kind of other clotting disorder.
I'm like, don't promise that. You don't know what.
Yeah, in an otherwise normal, healthy patient, they will not die from a broken toenail. So, let's see, so bleeding, yeah, so like if they're bleeding, especially profusely, that's something, get some pressure on it if you're able, and get them seen as soon as possible. So
Vomiting and diarrhea, if you have two of those things together and they're not able to keep anything down, I would say have them seen right away.
Yeah. Bloated, so referring to, their abdomen looking distended. So either that's like bloat, like we've talked about before, where their stomach fills up with gas, it flips over on itself, or it could be like food bloat, which not necessarily an emergency, but you don't know that that's what it, if you don't know that that's what it was, it's something that needs to be looked at. Or if they have, maybe they have a big tumor or something, they're ruptured and they're bleeding into their bellies, that's a bad thing. So yeah, if their abdomen appears distended, needs to be seen immediately.
Could have a pyometra. Giant.
Yep.
Uterus.
Yep. There's all kinds of funky things that can happen in the belly, that things like twist on themselves and cause issues with that. So those are my big categories of things. But a good point. Like vomiting and diarrhea, especially if they can't keep anything down, including water, that's bad. That needs to be seen. That's not like, let's see how they do overnight.
Right. I mean, if it's like one or the other, like they're vomiting occasionally, but they seem okay everywhere else, appetite is good, they're, acting normal. Okay, you can try a bland diet, see how it goes.
Right.
Or if they're just having diarrhea. But when you put the two of them together and they're not acting right, or they, if they try to drink some water and it comes right back up, that's bad.
Yeah, especially if they're smaller patients. So puppies and kittens or small breed dogs, they can get dehydrated very quickly. So that's a good reason. Even if they just got like some gastroenteritis, they just ate something that they weren't supposed to and they got a little tummy upset, well, they can get dehydrated pretty quickly too. So that's why we want to get that addressed ASAP. ASAP.
Why are you saying it like that?
Like it's some kind of technical jargon.
I said shmoo last night to my dad, and he was like, shmoo?
Schmutz?
And I was like, yeah, you just like shmoo it on, and then you stick it, I was talking about tile. I'm like, I'm pretty sure you just like shmoo some stuff on the back, and you shmoo it on this, and you stick them up
exactly what you do.
to each other. I was like, you put some sort of weird fancy pattern in the thing, and then you stick them together. And he was like, is that what you do? And I'm like, yeah, I'm basically a professional. Yeah. And he's like, then why are we doing this? Like, I don't know.
Well, the Jewish members of my family would be very proud of you.
Why?
For saying shmoo.
Shmoo?
Or schmutz.
Yeah? Is that Jewish?
Yiddish sort of things.
Oh, okay.
Yeah.
I must have learned it from you.
You probably did.
Just like spigot from my dad.
Spigot.
You guys, I have an outside water spigot now, and I'm really excited about it. I haven't had one in 10 years.
It's exciting.
It was in my basement before, so.
So what should people do if they have an emergency? Talk about real things.
You just... She never cares about me.
I care very much about you. But we're here to talk about emergencies. Your spigot is not an emergency.
It's an emergency spigot!
Okay.
Okay.
So if you suspect you have an emergency or know that you have an emergency, what should they do?
Well, if it's a breathing emergency, then you need to take it wherever is closest to you.
Yeah.
That's our rule of thumb. If they are having a difficulty breathing, if they're breathing really rapidly or they seem to be struggling, you need to go wherever is closest to you as far as emergency or general practice. Some of our patients aren't super close to us, so they may pass 2 or 3 other vet clinics on their way here.
Yeah.
Of course, we would like to see you here, but if it is a true medical emergency, we want you to get somewhere ASAP.
Yeah. Someplace that's close, because if they can, secure an airway and get them on oxygen and figure some things out, at least get them stabilized, before you do other things. It's better, why drive 30 minutes when they're not able to breathe, because they've already probably not been breathing well before that.
Right.
And so, what's wrong with you, Crystal?
What do you mean?
I don't even know what she's referring to, but I love it.
It's probably just my RBF.
It probably
There's
is.
nothing wrong with me. It's just
It's
my
just
face. It's just my face.
This is just how you look. You should apologize to everyone.
It's just a blanket statement. I need to wear a shirt that says, I'm okay, it's just my RBF.
Yeah. I'm not bad.
I'm
it's
not
just
bad.
my face. Just my face.
I can't help it.
I'll make you that shirt.
Oh, that would be great.
So if it's a breathing emergency, get wherever is closest. For other things, obviously during the daytime, call your regular veterinarian, and they will direct you where to go. After hours, there are several 24-hour care facilities in our area. The closest one to us, we're kind of in between. I think the one in Winghaven is probably the closest. So that's usually where we send people. But there's one in O'Fallon off K as well. This is because that will be coming soon. I look forward to that. And I know, I hear people all the time, oh, I don't want to go there. I don't like them. Well, sorry.
Right.
It's better to have your animal's medical needs addressed rather than worrying about where you're going. Yes, it is not fun to go to the emergency room at all. Been there, done that. But it's necessary. And they can at least evaluate your pets and see, triage them. To determine, the severity of the condition. Maybe it's not as severe as what you were worried it was, which is what we always hope for. But maybe it is very emergent and they need to be addressed immediately. And so, yeah, that's always your best bet after hours, for sure. Even though nobody likes going there, they know nobody likes coming to see them. They try not to take it personally.
I think most of them probably don't care. And another thing too, if it is a breathing issue and you're going to a different vet clinic closer to you, make sure you call them on the way there so that they can have stuff ready for you. And that they know that there is an emergency on the way in, because there's we've had people show up here and they're like, hi, I have an emergency, blah, blah, blah. And we're like, okay, who are you? And what are you here for? You want to make sure that they understand what's happening so that they can have the oxygen machine set up and everything's ready. If they need to get an IV catheter in, they can do that as quickly as possible and just kind of give them a heads up that you're coming.
Yeah, because we'll gather all of the things, like Crystal said, the oxygen, emergency drugs, fluids, IV catheters. We get everything ready to go so that as soon as that animal hits the door, we can get some things started. We might even set up the x-ray machine if we can get something that's going to indicate that, so that we can shoot those films as quickly as possible and get an answer more quickly too. Because you don't want to waste, it only takes a minute or two to set some things up, but those couple of minutes could mean a lot. So.
Right. Because were you gone and you came home and now your pet is acting that way? So who knows how long they were like that before?
Right.
Time is money. Every little bit is precious. So
time is money.
I don't know. That's not what I was wanting to say.
We
but
charge
it's what
you
came
extra
out, so.
if you don't tell us you're coming. No, that's
not what I can't think of my word.
Precious.
Time is precious.
Maybe.
There you go.
Maybe.
Just like money. It's precious.
Okay.
I don't know.
Oh, I love you.
God love you.
God love you. Bless your heart. Bless your those are the main emergencies, I think, the categories that we see.
And there are others. Like if your pet gets in a dog fight with another pet.
And there's certain things that I would consider urgent care. It's kind of like in people. They have urgent cares, and then they have emergency rooms. You don't go to urgent care if you're in like horrific car accident.
If your arm is
falling off. Yeah. You don't go to the urgent care for that. And just like you probably don't really want to go to the emergency room for something like
some sniffles.
Yeah. You had diarrhea for 3 days. It's if at all possible. So, you know, like, you don't want to be sitting in the ER waiting hours and hours and hours for something that is not truly emergent. You know, they're dealing with things that are emergencies. And same thing, you know, same thing in the veterinary community. We have emergency rooms. They're dealing with emergencies. They don't have the time to deal with your dog's ear infection that's been going on for a week. That is an urgent care issue that could be addressed the next day at your regular veterinarian, or should have been addressed, you know,
a week ago,
5 days ago.
Yeah.
They, you know, they're not equipped to handle that, number one, because it's not something that they need to deal with. And it's taking time away from people that actually, and pets that actually need them. What's wrong?
It's not letting me see.
Oh.
OMG.
It's because she never gets to watch us on this.
I know. OMG what? What did we do? With that, too, I want to say, if someone comes in with a medical emergency, we are going to see them first.
Mm-hmm.
We've talked about this a little bit on other Facebook Lives, and a lot of people are usually very understanding about that. But if a dog or cat comes in and they're not able to breathe well, we're going to address that. And, you know, we do apologize, and we try to say, you know, we're not sure how long it's going to be.
As soon as we can, we'll update you on what's going on and how long the wait's going to be if we know. We can try to give you some other options and things like that. But yeah, I always hope that people understand that if it was their pet, that's exactly what we would be doing as well. And my theory is same as like the euthanasias. If you have a problem with that, don't let the door hit you where the good Lord split you.
Weird. You really just said that, huh?
I did.
Okay.
Well, I mean,
it's true.
It's true. I mean, if you're going to be that upset because you were here for vaccines and you had to wait, 30 minutes or an hour because we had an actual emergency come in, sorry about you. Let me know where to send your records. Because that's what I think is appropriate.
Yeah. And like she said, we would do it for any one of yours, too. So whether you're a client here, whether you're not a client here, if you show up and you have a medical emergency, we're going to do everything that we can to make sure that your pet is stabilized and we can help them.
Yep.
So.
For sure. And I think 99.999% of people are totally fine with that.
Yeah.
I think I've only ever met one person that was not. I was like, sorry. Sorry, not sorry. She was there to get her dog's flu vaccine or something ridiculous. It was just like, that could wait.
Yeah. We have seen a dog come in with her intestines hanging out because she got her spay incision open. And we were like, okay, that has to happen now. Like, we can't wait.
I don't even know what else is on the schedule.
I really hope people are watching. It looks like there's only 2 people watching right now, so this is all good information. We try.
But yeah, that one we were lucky because we had receptionists that we could just be like, just call all our appointments and cancel them all. We don't really typically have receptionists here, so sometimes it's just all hands on deck, and people might be showing up, and it is what it is, and we figure it out.
Yep.
That's like our motto. We'll figure it out. It's fine.
It's fine. Everything's fine.
Everything's fine. We'll figure it out. We're good at that. But yeah, if anybody...
I keep burping.
Oh, I thought you were going to tell me a secret. It's like, what?
Crystal! I need you!
I did have to... I had an emergency the other day that I, was screaming for Crystal to come save me from a wasp.
But I thought it was a real emergency. And I'm like, why is she only calling for me? I don't understand what's happening. And so I, leave my lunch and I go running up front. I'm like, what? Oh, there's a wasp.
I don't do wasps. Waspses. I don't do those. Bees, fine. Flies, okay. Spiders, that's fine too. Wasps, no. No,
They
because
might fly at her.
they attacked me in my house one time, and I'm
So
traumatized.
you're traumatized from
It's
that.
my trauma.
I'm traumatized from my parents leaving me at Universal
Yeah,
Studios.
I had like a swarm of wasps inside my house. That was awful. That was
I'm just
awful.
imagining that.
Well, and I really considered like loading up all the dogs in my car and just leaving the house and being like, I don't know.
It's their house
I was
now.
Like, yeah, I'm like texting Jason and being like, the wasps own the house now. I got the kids out. We'll be going to stay at a hotel or something. I don't know.
We're going to Grandma Grandpa's.
Yeah, okay. Grandpa's. Oh man. Well, we gotta go. We got an appointment coming in probably soonish.
I think they're here.
Oh, okay. So yeah, we definitely gotta go. But if anybody thinks of any questions about, what if something is an emergency, when in doubt, call your vet.
And if you're worried, you need to have them seen.
Yeah.
That's one of the big
yeah,
things.
because we're not home with you, because that's part of it too. People will be like, well, does it really need to be seen right now? You're looking at the pet, not me. I can only tell what you're telling me over the phone. I can't see what's going on. From what you're describing, I might not think that it's an emergency, but maybe you're not noticing things
Right.
that I would normally notice,
And you know your pet better than we could ever know them.
Yeah.
So if you're concerned about it or they're not acting right,
Yeah.
you know better than we do what
Yeah.
their normal behavior is.
Yeah.
So
Yes, if you're worried, get them seen.
Yeah.
For sure.
that's the gist of
That's
today's
the gist.
video.
It's a good summary. Good
Yeah.
job.
See, it just all came around.
It did. All right, everyone. We'll have a wonderful rest of your day. Linda, we'll see you later.
Yes, we will.
Bye.
Just talk about my RBF.